Hi, this is Sumi Chang, the Executive Director for the Ontario Public Health Association. Thank you very much for dialing in to today's third mentoring leadership session. Today's special presenter is Carol Timmings. For those of you who may not have been attending the previous two or have not attended the previous two sessions, this is a commitment that OPHA is making towards its member in terms of supporting their own professional and career development as part of their membership towards within OPHA. This is a new initiative that started off this year. The first two speakers included Dr. George Passett and Dr. David Mowat. Today we have with us Carol Timmings, and we're delighted to welcome her on board as today's mentor. I would like to start off by giving a bio of Carol, and then the format of today's session will include Carol speaking about her background, some of the lessons learned, and insights that she's gained in her career history of her employment career history, and then there will be a bit of a session where we'll get to learn about Carol a bit more intimately and informally. And then we will open up the last 15-20 minutes or so to all of you so that you can have an opportunity to connect with Carol and ask her some questions that are top of mind for you around career and professional development and mentorship. So without further ado, I'm going to just jump right into Carol's bio and then have Carol jump right in. So Carol Timmings is Director of Chronic Disease and Injury Prevention and the Chief Nursing Officer with Toronto Public Health, City of Toronto. Throughout her 29-year career, Carol has worked with a broad range of stakeholders, community partners, and other levels of government to advocate for and to promote and protect the health of all residents of Toronto. She is past president of the Ontario Public Health Association and has extensive involvement in professional associations and advisory boards, including executive positions at the Association of Local Public Health Agencies of Ontario, the boards of directors for Healthy Active Healthy Kids Canada, and a past president of the Provincial Executive Committee of M.Ed, Public Nursing Management in Ontario. In 2010, Carol received the ALPHA Distinguished Service Award in recognition of her outstanding contributions in public health in Ontario. And without further ado, here is Carol, who will speak more about her own background. Thank you.
Thank you so much, Sumi. And thank you to OPHA for this invitation to participate in the Leadership Mentorship Series. A member of OPHA and someone who's worked in the system for many years, I'm very honored to be asked to share my story, my learnings, and a little bit about the insights that I've gained about leadership in the past many years that I've worked in health. My approach today is really going to be about telling my story and less about theory, although I will be talking a little bit about some of the theories that have shaped my thinking over the years. But I would say it is really a combination of theory and experience and mentorship that I have received. And so I'm going to weave in some of my personal thoughts and experiences along the way. And at the end, offer some guidance, if I may, to those of you in early or mid-career points in your careers, in the hopes that I can actually give back and share in a way that others have shared with me through my career. So, in the next slide. So my career history. I've called the presentation The Reciprocal Art of Leadership because I really believe, and hopefully by the end you will see, my view of leadership is very much one of reciprocity, that leadership is very much an interactive process. And so I hope I've captured the essence of that. Next slide, please. So just to give you a little outline, I'm going to talk about my career history, the way I view leadership very much as a social process. And I'll do a little bit of a definitional work there. I'm going to talk about the influences and then the words of wisdom. Okay, so I actually began my career as a nurse. I graduated from Queen's University in 1980, and I took my Bachelor of Nursing Science there. And after that, I began my career at Hospital for Sick Children. And I worked there in the area of cardiology, neonatal intensive care, and on the transport team. working with parents and families, and it was a fabulous experience. I really did enjoy it. But like many early on in their career, I thought I should really try something else. I was still quite enamored at that point with the acute care sector, and in fact had been given the guidance as I graduated from nursing school that nurses really should start their careers in the acute care setting, which I would have to say in my words of wisdom that won't necessarily be the advice I'm going to be giving. I then moved into adult medicine. I worked part-time both at St. Michael's and Toronto East General in ICU, CCU, and very much working in the intense acute care, highly interventionist environment. And I knew within myself just intrinsically that this was not for me. Uh, it was very episodic as patients came and went. I felt, while I certainly felt it was important work to do, I just felt there had to be a different way in my work and in my career that I could actually work with people in a more preventative or health promoting way. And I have to say that at the time, this was before I at least knew of the term upstream, downstream, but I certainly had tapped into the whole idea that I was not a downstream worker. I really wanted to work not just with the patient, but with the broader influences in health, in their health and in their daily lives. So some of my colleagues that I had, of course, stayed in touch with from university and just my network, some were already working in public health. And so they said, well, Carol, why don't you give public health a try? And I thought, well, why not? So I then moved to Scarborough Public Health, and I began working there as a public health nurse in the community. And I suppose in those days, that would have been mid-80s, it would have been more generalist role, I guess we would have referred to it then. And then the opportunity there in that health unit at the time, you could specialize. So I took the opportunity to specialize in areas of, I worked in high-risk parenting, I worked on the cardiac follow-up team, and I had a broad range of experiences there. And I was being given at the time some interesting leadership opportunities at the staff level, and really could feel myself growing and learning about community and about public health. I then decided that I would undertake graduate level education. I had aspirations to move up and across public health, and so I began my Master's of Education at Queen's University part-time. And I had done a fair bit of research. It was before Queen's had the Masters of Public Admin program that they have now, but they offered an interesting hybrid program, which was education and public admin. So my degree is sort of a unique one. It is a Master's in Education, but I really did a major in public policy and administration, which I think has served me well. I must say that completing that graduate degree for me was a key developmental point in my career. I clearly then had an interest in leadership because I focused my thesis work in the role of leadership in organizational culture building. And I actually did my research in the area of healthcare. And I really was interested in looking at the role that leaders play in shaping organizational culture. And while there had been a lot written in the business literature, interestingly enough, at that time in the early 90s, there wasn't a lot documented, certainly in public sector leadership, and not a lot about nursing leadership in even any realm of healthcare as it related to culture building. And so that was the focus of my thesis, and I'm going to talk a little bit more about what I learned about that along my journey. But I have to say that at that point, my thesis advisor was this dynamic, brilliant woman who I will credit with having shaped very much my confidence, validated and affirmed the fact that here I was, a young woman, juggling a career. I was a full-time manager at that time. I had moved into management. I had started my family. I think was pregnant with my third child at the time, and undertaking graduate level education. And so suffice to say, juggling a lot of balls. And to have that woman in my life as my advisor, truly she mentored me and coached me, and very much I have to say, energized me and reassured me that I could be successful in these endeavors. And uh, at that time, too, I moved into the director of healthy living at the Scarborough Public Health. And so it was quite a dynamic time where both my personal and professional life were really growing. So at that point, then, we probably would be in about 1997, and rumors of amalgamation were abounding. And by 1998, it was going to become a reality where 6 predecessor organizations were going to be merged into one. And that was I would have to say, an unprecedented time, certainly in our public health sector in Ontario, of anxiety, of uncertainty, certainly a big call for leadership in the system, and a big call for leadership among the 6 health units that were merging. And it was at that point in my life when I had the incredible fortune, probably the next great milestone of mentorship in my life, where I was very privileged to be recruited as one of the 8 directors that would shape the leadership team of the new Toronto Public Health. And that was another monumental growth period for me. I was stepping into a very large organization at a time of 6 cultures. Fortunately, I have to say I was able to dig deep into my learning about organizational culture and the role that leaders play in shaping culture. We were basically bringing programs and policies and services and ways of doing business together under the leadership of a brand new city, the then called Mega City, and under the leadership of Dr. Sheila Bazer, who was, and I have to say, even in her death, continues to be a tremendous inspiration to me. And Sheila, too, had a way of mentoring, a way of bringing out the best in people, a way of making you want to go above and beyond even what you knew within yourself was possible. And so she's another person, another mentor, another leader who inspired me and who I learned a tremendous amount from. So that is where my 15 years of leading in a very large, complex organization, I certainly grew. And I've learned from a tremendous range of people. I've learned from colleagues at my own level in the organization. I've learned from my staff. I've learned from community partners. And I also took opportunities outside the organization. Sumi mentioned in my introduction the opportunities to lead in ANDSOOHA with my nursing colleagues, to be president, and to have the confidence of my public health colleagues to allow me to take on the presidency of OPHA. I learned so much through that process as well. So it's something to acknowledge that my development as a leader happened only in part through education and my experience in the organization. It's also happened in outside of my formal work structure in voluntary organizations and also in community. I've learned so much over the years from community leaders, from partner organizations, from just newcomers, from so many people. I've learned what leadership in my mind is all about. Next slide, please. So I want to go on to talk about a little bit more about my personal views of leadership. And all of you who have patched in today, I'm sure, have your own thoughts on leadership and your own experience in leadership, and could subscribe to many theories about leadership. But for me, I view leadership really as a social process. And those of you who know me well, that's probably no surprise. It's a social process, and it's also a lifelong journey. It certainly has been for me. I don't see it as a destination. I think becoming a leader is truly something that you develop over a lifetime. It's not a destination. Those who think or who look at leaders who say, well, they're a leader, it's not a place to rest on laurels to say, I've learned everything I can learn. It is a lifelong journey, and that's what keeps, I believe, my energy levels up, is learning every day from others and embracing experiences that way. To me, leadership is really also about reaching out and connecting with others. It's that reciprocity. It's that sharing what I can, but listening and being open and learning from others. And bringing others into that leadership process. I have, over my career, moved into more positions of formal leadership and influence. But all that I have brought to that, I hope, has been about bringing others into that process and inspiring others to action. If I have done that at the end of my career, I will feel that I have made a contribution to public health and to the system overall. Next slide, please. Leadership defined. Of course, I couldn't present without having some formal definitions of leadership. And I actually did go back to look at, because I really think it wasn't so much going into the current literature as it is about looking at the theorists that influenced my own research in leadership and culture building. And one of them was Bryman back in 1995. And Bryman had done earlier work, but this particular definition of Bryman talked about leadership as an exchange process in which leaders and followers are interdependent. Now, I have to say that he was quite controversial in his time, talking about followers, because there was a whole movement in the literature at that time around communities of leaders, which I really was subscribing to. And that was what I was embracing in my own experience. And so I wasn't as enamored with the leader-follower constructs as I was about the theory of exchange in leadership, about influencing and allowing you to be influenced by others. So it was the fluidity of the leadership process, involving not only your own awareness as a leader, but your sensitivity to others. And I don't mean sensitivity in the way of, in a superficial way. I mean about the sensitivity about being open to the goals and aspirations of others, to the needs of others to be able to influence and be part of a leadership process, whether that's leading change, whether that's problem solving, policy leadership, organizational structural changes. It's about being aware of how others will be included in that process and what they bring to that and what they need out of that process. It's about sharing that process. And that really resonated with me. And I believe and I hope has defined me very much as a leader. The day that I lose the sensitivity of others in the process is the day I hope my mentors and coaches point that out to me, because I want that to very much be the core and essence of who I am. Another influencer in my thinking, another theorist, next slide please, was B.N.Sc. B.N.Sc did a lot of early work back, decades ago in the 80s and 90s, and continues to do work today on leadership. But I want to really try and instill in you what has shaped me on my journey. And that is that B.N.Sc viewed organizations as communities of leaders. So, of course, you can appreciate by this point my career is well ensconced in public health, and so I'm enamored with community. I'm enamored with thinking of organizations as communities. I'm enamored with the power of communities, the need to have organizational boundaries more permeable, and community and those that we serve and work with in our public service to be part of my leadership and our leadership. And so B.N.Sc really conceptualized organizations as communities of leaders. And while he acknowledged leaders, he didn't deny that organizations are highly bureaucratic and that we actually need structures to bring coherence to organizations. He didn't deny that. But what he talked about was how leaders work within those structures and about acknowledging formal and informal leadership. And so that really resonated with me. That excited me to think that even though you might be in a formal position, it wasn't all about you. It validated that in me. It wasn't about being at the top. He viewed leadership as being across and throughout organizations. And I subscribe to that today. Some of the biggest influencers on my work are my staff, are the community that they serve. The more I can hear the voices of staff and managers and my colleagues, the more I feel informed as a leader. And the more I feel that I can both contribute as a leader and that I can reach out and have others contribute to my aspirations and to join in goals and actions that I may think are worthwhile and to see where they are in relation to that. And it's not about a zero-sum game. That's a kind of a famous, Venice didn't actually say it that way, but in essence, it wasn't about someone having power and others losing it. It wasn't about the power game. It was about honoring and respecting who ultimately has accountability in decision making or in problem solving, and we all work in very political environments, but it was about acknowledging shared power. And I think in our public health work, and as we look at our passion and commitment, or mine, I'll speak to my own passion and commitment to health equity and to looking at the role we play in reducing the disparities we see in society, it is about shared power. It isn't about turning organizations into chaos and turning them upside down, but it is acknowledging where leaders fit in that. So he truly did influence my thinking. And then finally, on the theory side, more recently, I'm very much a Drucker fan. I really loved Drucker's sort of leadership concepts that he put forward in his work and publications around 2002. Still a decade old, but it's what really excites me in my work and excites me when I understudy other leaders and leaders in other organizations. And it is the be no do. Very simple. It's about the values, the beliefs, and the inner character of a leader. That's important to me. It's important. The people that I admire as leaders, I admire the way they wear their values, the way they live their values in their work. Their beliefs aren't separate from their work. It's not separate from what they do. And they're people of substance. It's their inner character. That's a way of being as a leader, as far as I'm concerned. Of course, there's ways of knowing. To have credibility, of course, there's your knowledge base, your skills, your competencies. It's what you bring to your work. It's the way you think, the way you synthesize material, the way you integrate knowledge. It's all about knowing. And all of the knowledge, of course, shapes your thinking. It shapes the way you analyze things. It shapes your view of the world. And I like to think that I bring that to my work. I count on others to bring their knowledge into the process. Whether I'm taking action at a programmatic level or we're looking to influence a huge policy change, the more we bring the knowledge of others into that process, the better outcome we'll get. So it is about knowing, and that's what Drucker says. That's the hallmark of a leader, of leadership as an art. And then, of course, it's doing, being, knowing, and doing. You can't just sit back and be a leader. You have to take action. You need to take action yourself, and you need to inspire others to take action. And when I look at those folks in my life who have inspired me that way, to act, to have the confidence to act. It is really about those who have kind of taken the process of knowing and doing to actually make a difference, to act with purpose, to inspire others, to help you shape a vision, and then to act and do and make that difference, to enact. So that enactment of leadership is key to my feeling about leadership. We all know that leadership theories have emerged from so many areas of study, whether it's sociology, psychology, health, social sciences. I do a lot of reading about nursing leadership. But regardless of the genesis of the theory, I hope you find that theoretical framework that you can integrate into your way of being, because I do think that's what will shape you and your work. So on to kind of what's influenced my development. It probably won't come as a surprise that it is about relationships. I work relationally as a person. In all the work I do, I love people. The more I can interact, the better. And I have to say, relationships, whether I was a PHN working with clients, whether I'm working on a committee in a cross-sectoral way, in some of the most difficult times in my career, in my life, it has been about relationships. In times of conflict, in times of unprecedented change, I can always come back to those relationships. They're the same relationships that have inspired me are those relationships that have challenged me, that have sometimes been really constructively critical of a way I've approached something. That matters. I have grown tremendously and hope to continue to grow through the relationships that I have. Um, I would also say that some of my relationships have been very much deliberate. Um, I've admired people and I've made a point of forming those relationships. And that's part of my advice for you. Reach out and intentionally build relationships, not with just the people you think you're likely to be friendly with. Build relationships with people that you think very differently than you do, because that's how you will either stretch your own thinking, or you will start to maybe question and reflect and refine your own way of viewing the world. I've changed some of my views tremendously by reaching out and working with others who actually come from a very different place than I do. They either change my beliefs about something or they further validate my own character and beliefs. So that's critical. Coaches and people who inspire you. You know, when I was coming through my own early years, sort of early and mid-career years, coaching and mentorship wasn't nearly as formalized as it is now. I think it's wonderful. Series like this, leadership mentorship programs in organizations, I encourage you to take advantage of that. I'm going myself to a leadership program in the summer, and I love participating and sharing in things like this. I clearly got mentored and coached throughout my career. It happened in a more, I would have to say, subtle way, or it happened in a more integrated way. People obviously reached out and coached me, and I obviously reached in and reached up and asked questions and clearly aligned myself with people, and they were from a range of disciplines. That's the other thing. I would encourage you, we're so fortunate to work in such a rich multidisciplinary environment, and make that work for you. Not only do we do better work together, but I have learned so much from other disciplines, and I know that many of you have joined today in this series, and thank you for those of you that I've learned from, and if I haven't met you yet, I hope I will personally. But people in my own organization here at Toronto Public Health, my MOH David McEwen, my director colleagues. Liz Jansen is someone who isn't with Toronto Public Health anymore, but she influenced me tremendously. I shared an office with Liz when I made my first trip downtown. I often tell the story. I was like the country mouse coming to the city. And when we first amalgamated as a new city, we had to share offices. And I couldn't have had a better mentor and kind of guiding me. It was quite a time in my life. I had a 4-month-old baby, and I had just lost my dad to leukemia the fall that I took on that job. So having people like my SMT colleagues and Sheila and Liz and others there with me certainly were tremendous influencers. Positive learning environments, that makes a difference. I, for the most part, have had very positive learning environments, and by positive learning environments, I mean environments that give you that opportunity to work with a manager who gives you a chance to take on something new. When you go with an idea and say, I'd really love to lead this, I'd love to take this program on, to work with someone who has that confidence in you, that's key. Managers play a real key role in that, and I encourage those of you who are managers to give some serious thought to that. What kind of an environment, what kind of a work climate are you creating in your organization so that staff feel confident to step up and say, I'll take that project on? Is it an environment that you can take a risk in, that you can try out new ideas, that if you really blow it, are your knees going to be, your legs going to be taken out from under you, or are you going to be feeling okay that I've learned through that, right? That has to be in the environment you're in. And those of you who find yourselves in environments that aren't fostering that, then I think it's time to take a look about what is it in that environment that isn't positive for you. Maybe you need to change it up a little bit. I did that in my, the thing I love about public health is I was going to try it for a year or two, and here I am, right? 9 years later, I felt every few years I had a new career. I think there's probably very few programs that I haven't worked in. CDC would be the only one that didn't really call me in terms of any of my loves or desires. Otherwise, I would encourage you to find that place in public health where you feel you're inspired and invigorated to learn. I have a way of people either energize you or they blow out the flame. You know, the negative people who just kind of bring you down. Steer clear of those people. You know who they are, right? We all have them on our teams, I'm sure. You can't just hop all around, but you'll know when you're with those people who inspire you and who really affirm your thoughts and even support you from the side to take on new opportunities. And then there are those who are watching you and saying, you think you can do that? Not so fast. And they're out there. You'll meet them wherever you are. Try and steer clear of those people to the extent that you can, the ones that blow out the flame all the time, the naysayers. And shape and find those environments. If you're in positions to shape those environments, and I think you are. In organizations, you absolutely are able to be that person who encourages your colleague. Okay, so my words of wisdom. Next slide. I've spoken a little bit to these. See the possibilities within yourself. My most influential coaches and mentors along my journey, and I had opportunities to go and work on provincial initiatives. I've sat and still do on community coalitions. They're people who actually encouraged me or allowed me to see new possibilities in myself. So what I'd love you to do after this session today is a little bit of inner reflection. Am I really optimizing those possibilities that are within me? Just do a little bit of that soul searching and nurture them within yourself. And some of that self-nurturing is reaching out to others and stepping up to something that may not feel that comfortable. Some of my greatest learning, I know David McEwen said to me one day at a meeting, I said, oh, David, I'm really not a numbers, I could take it on. I could do it if I had to, but oh, really? And he's like, then that's where you should go. Don't just stay in your comfort zone, right? Take that on. And, I did. And I learned something about myself that, gosh, I still didn't love it, but I learned that I could do it, and I could do it with some zeal and take it to a new place. So I would encourage you to do that. Kind of go into a zone that doesn't always feel so comfortable. Reflect on the values that guide you. That has served me well. If I don't feel comfortable in terms of something, I'm prepared to revisit it. But if something is taking me to a place that is really putting me in a real values conflict, um, I have to revisit that, and that has served me well over my career to date. Um, I'd like to think that my values have guided my interactions with people. At the end of the day, I have a very simple thing. Leaders have to look themselves in the mirror. You've got to go home, no matter where you've been leading and from whatever vantage point in the organization. And that's what I'm going to be kind of closing with is I believe in communities of leaders. You're leading, whether you're considering yourself, I'm frontline staff or I'm whatever. And it really hurts me when I hear people say, or troubles me when I hear people say, I'm just a, right? You have tremendous leadership ability to lead from where you are. And I think in terms of reflecting on my own values, just have to be able to look and say, did I do the best I can? Did I do the right thing? I made a difficult decision. I've made some very difficult decisions along my career to date. They were tough decisions. But I have to look in the mirror at the end of the day and say, do I feel that I made the right decision with all the information I had? Does it sit with my value base? And I need to be able to answer yes. So I think that's a big part of who I am as a leader, and I hope is what I model in my day-to-day interactions with staff. I've talked about seeking out challenging opportunities. Do that. If it feels stale, it is stale, right? I'm not saying that everything is going to be dynamically exciting every day, but you do have to have a potpourri of things. And some of what's in your basket of your potpourri better be something that challenges you or inspires you. And then that point about leading from every vantage point. I think you need to. I think you need to, if we're going to make a difference in the health outcomes, I think that's what calls us every day in public health, to make a difference in the outcomes and the lives and the health of individuals. That's key. Yes. My last slide, which is really a little, do I have time, Daniel, to read this? Yeah. I wanted to sum up with a visual, which I actually incorporated into my thesis. I just have to find what I want to read you, because it is a, now this I will need my glasses for. It is a, we can only hope I have them handy, folks. Anyway, I'll try to do it without. This is actually the way a composer illustrated leadership. It was a Stromberg, R.D. Stromberg, and this is an excerpt from a composition that I actually included in my thesis on leadership and culture building, and I wanted to share it with you because it inspired me, and I think it sums up the way I view leadership. So here goes. One day, lying alone on the lawn on my back, with only the drone of a distant train on some far-off track, I saw before my eyes, 5,000 feet high or more, a sight which to this day, I must say, I've seen nothing like before. The head goose, the leader of the V, suddenly veered out, leaving a vacancy, which was promptly filled by the bird behind. The former leader then flew alongside, and the formation continued, growing wide. And he found a place at the back of the line. They never missed a beat. That's how I found out how the goose can fly from way up north to way down south and back again. But he cannot do it alone, you see. It's something he can only do in community. These days it's a popular notion, and people swell with emotion and pride to think of themselves on the eagle's side, solitary, self-sufficient, and strong. But we are who we are. That's something we can't choose. And though many may wish to be seen as the eagle, I think God made us more like the goose. So that to me is powerful. And it's about leading together and not just being at the top of the V. And knowing that when you step out of your leadership role, there isn't this huge void. It's a community. It's a flock. So thank you. Thank you for the opportunity.
Thank you. So we're moving on to the other component of today's mentoring session, and that is kind of one of my favorite parts of it, which is the leaders' questions. One of the shows that I like to watch is the Actors Studio, and my favorite part of the Actors Studio is when there's the question and answer period between the facilitator and the actor. So I pulled out a handful of questions, and if you can respond to them, that would be great. The first question is, what is your favorite word and why?
I would say, I would say in this context, my favorite word is authentic, authenticity.
Okay.
Yeah,
All right.
yeah, because I think it says a lot about the real thing. That's my favorite word.
Okay, great. What is your least favorite word and why?
Ooh, constraint. Yeah, constraint to me, it just feels just like it sounds, you know, limiting, limitations.
Okay, what turns you on or what interests you?
Oh, what turns me on? I love being able to talk through complex issues with people. I like to be able to, I'm energized and turned on by talking through things, by problem solving together and getting to a new place together. I guess I'm energized by people.
Okay.
Yeah.
So what turns you off then?
Well, I'm not a very, I have to say, I'm not a very, if I have to spend a lot of time alone, if I'm assigned to a very solitary, lone type task, it's not me. It kind of, you know, there's certain things you have to do on your own, but it de-energizes me a little bit. It kind of, yeah.
Okay.
And therefore, people who are loners and who really don't want to be part of, and by that I don't mean, you know, the introvert type. I love working with introverts as well. I mean, I think there are people who thrive just by doing solo work. That's not me. If I had to work that way, it would de-energize me, I know.
Okay. So what profession other than the one you're in now would you like to attempt?
Well, gosh, I really love being a nurse. What else would I attempt? I might do something, I might do something where I could maybe work more in a human resource organizational development kind of area, right? I don't think they're necessarily mutually exclusive, but I think if I were to take on another career, it would be that kind of maybe more formalized organizational development, growing people in organizations type thing.
Okay. Next question. You've kind of alluded to it. What profession would you not like to do?
Oof. Accounting, forensic auditor.
Somehow I knew you were going to say that.
Yeah. Important roles, but wouldn't be one for me.
Thank you. So that concludes kind of the leader's question. And we have a couple of minutes now to open up the floor to the audience. And maybe what we can do is read the questions for you.
Yeah.
and then if you can answer it. So I may need a little bit of help from Daniel, who's currently helping us today. This is really just a comment. So this one here. So this is from Tammy C. Yates. Not sure if you know her, but have you ever thought of working in international public health? Example at WHO?
Oh, wow. Well, I have, sorry, now my voice is breaking. I have certainly thought of at some point in my life doing some global health work, working internationally. I would love to probably at some point have my career come full circle where I would actually work very much in and with communities, in a practitioner kind of way, because I think I could bring my lived experiences. I kind of look back at, my days working as a public health nurse and even my days of working in hospital, and I'm so much more, mature in terms of my knowledge and how I viewed things then and how I view things now. And I think I could really make, I hope, meaningful contributions in an international perspective. And my passion to actually reduce the inequalities I see and to really get out there and do something in third world countries is very much alive. So have I thought of it? Yes. When my family gets at the right point and I might have that opportunity, it's something I just might embrace. Thank you for the question.
Another question from Kelly Ferrugia. Apologies if I mispronounced your name. Carol, can you comment on how you feel the new role of the CNO will contribute to overall public health capacity?
Well, of course, I really am thrilled with that new role. I think the chief nursing officer role will contribute greatly. I think that nursing leadership is alive and well at every level. I think that as nurses, we can bring our abilities not only to enhance nursing quality practice, but I think we have a lot to contribute, obviously in an intra-professional way, to organizational effectiveness, to bringing to a new level the quality assurance agendas in organizations, to decision making. I think there is a lot in our nursing knowledge base that really is so much broader than the discipline itself. And I think that we can bring that to bear to organizations, and that we can, together with our other colleagues from other disciplines, really make a leadership contribution to organizations. I think nursing is about half the public health workforce, and I think if we can unleash the leadership in the workforce, not only with nurses but across, we'll make a tremendous impact. So I think the CNO role is a way of formalizing that, and I hope that does actually become a reality in organizations.
Great question. Thank you for the response. This is from Jane, and she asks, as a young professional, did the process of knowing yourself contribute to your ability to lead?
Absolutely. I would say the process of getting to know myself, which of course is, hence my comment, leading and learning are lifelong. You really do have to get to know yourself. And I've done that and continue to do that. I think there are certain things that help you do that. And that is, and it's not always in the successes. Getting to know yourself is how you challenge those, or how you accept failure, how you deal with conflict, how you deal with disappointment, adversity. I've learned a lot about myself that way. Learning to know what really matters. At a relatively young age of my career, I recognized 2 points in my career. I got to know how much my career meant to me. One was, of course, that point when I juggled my family life, my work life, and my postgraduate education. I knew that being in public health was very much a part of who I am as a person. probably the other point when I talked this through with Sheila Bazer, and who would ever have known that she would have her own cancer challenge, was when back in 2000, I was diagnosed with breast cancer. And at that point in my career, I had to make a serious choice. Am I going to I had a very young family, balancing a very demanding job. I, at that point, was acting director of Healthy Environments. We had the big dirty dining outbreak here, media fiasco here, and I was leading a big regional program. And I had to make a choice about where my career fit in who I was. And I can honestly tell you that I got to know a lot about myself as a person and did a lot of soul searching. And as a mentor, she helped me do that. So, yeah, knowing yourself is a lot about knowing who you'll be as a leader, I think.
Great question. Thanks for sharing a bit more personal details about yourself.
Yeah, well, it's all about who I am.
Thank you for that. I'm just conscious of the time. I know we're down to 19 speakers, but 19 participants, but the questions are really great, and Carol's responses are really great. So hopefully those of you would be willing to stay on additionally. We have next Marty Mako. Marty, for those of you who may not be aware, he's actually board director for OPHA, and I just want to say hello, Marty. He asked Carol, thanks for an inspiring talk, Carol. In hindsight, are you glad you spent your first years of nursing in the clinical world, even though it wasn't meant for you, beside in brackets? Would you recommend that path to others, such as starting a clinical setting versus spending an entire career in public health? Interesting question.
Yeah, thank you. Hi, Marty. If you're still in the room or on the line, Marty, I would have to say that I wouldn't say it is a prerequisite by any means. I know some universities are still saying, certainly to nurses, that, oh, you better get your grounding in the hospital. They're very different practice environments, right? And I would say one doesn't necessarily prepare you for the other. Having said that, I certainly learned a lot about what I didn't want in my career. I have utmost respect for acute care and the need for acute care. But I think it probably galvanized my career path, having spent that time in acute care. I knew that wasn't what I wanted, and I have subsequently had a chance, several chances actually, to go back into acute care. So I think it galvanized that I have spent my career where I wanted to, and am spending it where I want to. As I said, public health to me has such an incredibly broad mandate, and I have had the good fortune of moving across and up in the organization, and so many opportunities. It has never felt like people say to me, you've spent your entire career in public health. And I probably won't end my career directly in public health. I do plan to go on and finish my career and do something else. Chances are it'll be related to public health, but I haven't really landed on what that'll be yet. But I would have no regrets, because I think public health allows you to work in such a broad area and to work with such a broad range of sectors and partners that it's never felt stale. So looking back on my life on Judgment Day, I won't be sorry I've spent the majority of my career here.
This question is from Annette Sunveld. In your last year at work, what is the one thing you're most proud of?
If I was in my last year at work, what would I best be proud of? Wow. I would be most proud of whether or not where I've made that contribution would be, I would like to think that people feel I've been an inspiring leader, and not just people in the organization, but I would like to feel that I've made a difference in the health of the community. And I would like to believe that I've helped advance our commitment to the determinants of health through my leadership role, and to reducing the inequities that we see right now in health.
Thank you. So it looks like that is the sum of our questions from the audience. I do have one question. I'm conscious of the time, but it looks like a handful of you are still hanging in there. But I really would like actually to get your ideas and thoughts on this, and that is, I'm curious about mentorship within the public health sector in our field that we're in right now. I just want to kind of express some thanks to a lot of our members who, when we initially launched the idea of this mentorship program, there's a large, quite a significant number of managers and senior managers in public health who expressed wanting to be a mentor to potential mentees within OPHA's membership. But I wonder, given the current environment, is it difficult or easy to find a mentor outside of those structured pieces within an organization? And what would you recommend for those young professionals or even mid-careers who are looking for mentors but having a difficult time? What would you suggest that they do?
Yeah, well, certainly the point I made about taking advantage of both structured and unstructured mentorship, sometimes where the most impactful mentorship can happen may be where you least expect it. I really do believe that formal mentorship is critical. I think we have to make time in organizations to allow that to happen. What I hear in our own organization is, I would love to mentor in a more formal way. I just don't have the time, because people want to do it well. And we all have many competing demands on our time. I think mentorship can happen in a really integrative way. It's about bringing people into your processes, your thinking, your experiences, that action learning approach to mentorship. I also don't think that mentorship has to happen within your own sector. I would encourage, some of what I have learned really has come from the business sector, not-for-profit sector, I think voluntary sector. I think look for the learning opportunities and the mentorship. It's sometimes where you least expect it. But I do think organizations need to make mentorship much more a part of their organizational development plans, much more about their human resource planning. If we're going to grow and have succession plans in our organization and know what our organization needs, we need to grow our leaders. And you need to grow them at all levels. Most big organizations are pyramids. If you're waiting for leadership to get to the formal positions of power, so to speak, in some organizations you're going to wait a long time. That's why the bloom where you're planted analogy is so important. Conversely, I think effective organizations unleash the leadership at all levels. I see too many organizations out there that are overmanaged and underled. And they're underled because they don't have mentorship and leadership programs that really, invigorate that in organizations. So I think we have to make time for it. We have to name it as a credible and worthwhile activity in our organizations. And we need to reach across to do it.
Great, thank you for that. So thank you so much, Carol. It looks like we're
My
a little
pleasure.
over the time.
Thank
but
you.
A real pleasure. It's been extremely interesting. Thank you for being so open and sharing your history and giving some insights to us on kind of your own career journey and the lessons learned along the way. I think has certainly helped to further complement all the other mentoring sessions. And this session will be recorded, so if you want to share this with all your other staff,
or view it myself,
view it yourself,
and be reflective, self-reflective.
Be self-reflective. There are also the previous 2 sessions that have also been recorded. So for those of you online, you can also visit those recorded sessions that are on the OPHA website. I would like to advertise a little our next mentor, and that is John Garcia. John will bring a different aspect. His background's been kind of very, it touched a lot of different areas in a lot of different fields. And he will also further add to kind of our broad understanding and broad appreciation of leadership within OPHA. So thank you again, Carol, for all your time. Thank you again for all of the OPHA members who dialed in. And Daniel is prompting me now to advertise this upcoming event that we're having, which is on marketing towards children. This is an OPHA-NRC inaugural event that will take place. This is the first event, and this year's first event will focus on marketing towards children. It will be hosted here in Toronto. We have a number of really great speakers, including Brian Cook from Toronto Public Health, as well as a few other folks who have an interest. The focus will include both on understanding policy issues related to marketing towards children, as well as sharing some resources and personal lessons learned from a number of health units. So I hope all of you, or those of you who are online, may be able to attend or tell your colleagues about it. and look forward to having all of you connect at our next mentoring session. And thank you all, and I hope you enjoyed the session. And thank you again, Carol.
Thank you. My pleasure.